So, Dr. Bowden, one question I had is, what is the training for a registered dietitian look like? What schooling do you do? Do you pass a test? How do you become a registered dietitian?
So to become a registered dietitian, you go through, first of all, a bachelor's program in dietetics. And then that's followed up by an internship that's usually a year and a half. And then there's the registration exam that you need to pass after that point. They are going to be requiring a master's degree after 2023 for registration for all dietitians. So it does take quite a bit of time and training. It's a really diverse program as far as background for dietitians. There's instruction in basic nutrition, in counseling with patients, the science portion, the psychological aspects of nutrition, and helping people to be able to understand what they're learning, as well as then there's the other half that's the managing restaurants and things like that.
So what was your first job as a registered dietitian? What were you doing?
So I started as a clinical dietitian in a hospital. My first assignment was to work as a PRN dietitian, which is basically I covered whoever was gone that day. And that was really a great starting point because I had the opportunity to work with surgical patients and cardiac patients, with psych patients, newborn intensive care, outpatient. We had a wellness program at the hospital that I worked in as well. And then I transitioned into being full-time with the newborn intensive care unit.
Wow. What was that experience like with newborn intensive care?
It's very fun. Sometimes it's really challenging to help people understand their nutrition needs, and the babies always listen, and the parents always listen. So that's kind of nice, but it was a wonderful opportunity to see these babies who were coming into the world with some challenges and arriving mostly before they were supposed to be, and helping to get the nutrition that they needed, lots of monitoring of weight and blood values to make sure that we were getting the exact nutrients that each of those individual children needed.
And then my understanding is you went back and did a PhD, and it specifically related to the disc in the lumbar spine. So tell us a little bit about that.
I did a PhD program in exercise physiology, and the emphasis was on looking at how nutrients, and specifically that's the nutrients flowing around with the water in the disc, would move, and the impact that our activity levels have on that. And I found that if we get even just a little bit of vigorous activity in every day, that's going to make a big impact on the overall nutrition of our disc. If we're getting up and moving around more often, even if that's not that vigorous activity, just not staying sedentary, we're going to have healthier discs.
And finally, what made you interested in coming and being a part of our wellness program at Summit?
I love Summit's vision of helping people to be able to become healthier and have their lives be improved, and I was excited to be part of that vision.
Good. Well, we're very grateful to have you in the practice, and grateful to have a resource for patients as a very important part of getting their life back, to improve their nutrition and a variety of other things to give them the best chance of success. So thanks for all you're doing.
Thank you.